Hello everyone, my name is Kayla. Today I'm going to be presenting on periods, hormones, and sex education for teens. I am a registered nurse and student nurse midwife. So let's get started. In order to understand the context of this presentation, we must go over some basic anatomy. This is a picture of a vulva. The vulva consists of the clitoris, labia majora, and labia minora. The clitoris has tons of nerves and is linked to sexual pleasure. Underneath the clitoris is the urethra. This is where you pee out of. The labia majora is on the outside and the labia minora is on the inside. These both help keep the inner parts of the vulva and vagina safe from bacteria. Below the vagina is the anus. The internal female anatomy consists of the ovaries, which hold follicles, also known as immature eggs, the fallopian tubes, which help carry the egg to the uterus, and this is where the eggs are fertilized. The uterus, this is where the egg is implanted to grow into a fetus. The cervix, which is the very bottom part connected to your uterus. The cervix opens slightly during ovulatory phase and during your period. It also opens to be 10 centimeters wide during vaginal birth of a baby, which is the size of a donut. It is an amazing organ. So let's talk a little bit about the male anatomy. Sperm, which contains half of the genetic material to produce a baby, develop in the testicles. They then travel through the vas deferens and exit the penis during ejaculation. The penis has the ability to get hard when it fills with blood. Signs of puberty include a growth spurt. Your breasts may begin to grow and your nipples may change. Hair will grow on your armpits and around your vulva. Leg hair tends to darken. You may notice an increase in sweating and skin changes, and eventually you'll begin your period. What is a period, you may ask? A period can also be referred to as a menstrual cycle. It is when the uterus sheds its blood lining and exits through the cervix and out of the vagina. The average age that a person gets their period is 12 years old. However, some get it earlier and some get it later, but usually between 10 and 15 years old. It typically happens on average every 28 days, but cycle lengths vary in each person. Period discomfort. Mild cramping around ovulation and during your period is common. If period pain is unmanageable, ask your parents to make you an appointment with a midwife, a certified nurse midwife, or an OBGYN. Heavy periods that cause you to soak through pads or tampons every 1 to 2 hours is also something that should be discussed with a healthcare professional. You can use Motrin and/or Tylenol to help with discomfort, as well as using things like heat packs. It is normal to feel more tired during your period, so if you feel like you need or want to be more restful during this time, just listen to your body. Let's talk about period products. You have menstrual pads, which are worn in the underwear. There's conventional, organic cotton, reusable/washable. You have tampons, which are worn inside of your vagina. You also have conventional and organic cotton. If you're going to use pads or tampons, I highly recommend using the organic cotton variation. Your vagina is this very sensitive area and it needs mild products. Conventional and scented period products have been linked to issues with the vaginal microbiome. Menstrual cups are worn inside of the vagina. On this slide, there's a picture of a menstrual cup. Unlike tampons that need changed every few hours, menstrual cups can be worn up to 12 hours, which is an amazing tool. Sometimes menstrual cups are tricky to place in your vagina, so they might not be right for beginners. And last but not least, we have menstrual underwear. They are just worn as normal underwear, and they are washed and reused. Ovulation. Periods are triggered by ovulation. Ovulation is when a follicle is released from an ovary. When the follicle does not get fertilized by sperm, it then triggers your period to start. Ovulation typically happens mid-cycle, so if you have a 28-day cycle, it would happen around day 14. If you had a 29-day cycle, it would happen around day 15. Okay, let's talk about hormones. There are many hormones that play a role in your cycle. There are 3 phases of your cycle: the follicular phase, ovulatory phase, and luteal phase. So, assuming you have a 28-day cycle, the follicular phase is days 1 through 14 of your cycle, which would be the first day of your period to the day that you ovulate. the first day of your period is defined as the first day you need a menstrual product to catch your blood. The ovulatory phase is around day 14 if you have a 28-day cycle. And then after you ovulate, you are in the luteal phase until you get your period again. Okay, so let's talk about discharge. It is normal to have fluid and mucus come out of your vagina. Normal and healthy discharge looks like clear or white in color. It's a normal odor, so your vagina has this odor that is unique to each person. It's usually not foul smelling and it's not strong. Whenever this mucus or discharge dries on your underwear, it looks kind of yellow. And it changes in consistency throughout the month. So you might notice right after your period, you might have a thicker discharge, something in the consistency of lotion, and then during ovulation, it gets really thin and watery, and then before your period, it gets back to this lotiony consistency. Abnormal vaginal discharge looks like gray, green, or yellow. It can be chunky or cottage cheese-like, and it can have a strong foul odor. So it's really not a pleasant thing, and oftentimes you also have vaginal itching, so this is something that you would want to see a healthcare professional about. Okay, let's talk about how to keep your vulva healthy. Your vulva really doesn't need a lot of help in keeping itself clean. When you're bathing, you really only need to use water. If you choose to use soap, use a mild, unscented soap and only bathe the outside of your vulva, so not inside where your vagina is, just the outside. Wear cotton undies, change your underwear daily, eat healthy, eat lots of fruits and veggies, and it's really, really simple in how to keep your vulva healthy. Okay, let's talk about where do babies come from. So a sperm and egg must meet to cause a fertilized egg and eventual pregnancy. Sperm from a male enters a female's vagina and travels through the cervix into the uterus where it finds the awaiting egg. Sperm is deposited into a female's vagina during sex when a male ejaculates, or it can enter the vagina or uterus using fertility treatments. A female is fertile for about 4 to 5 days before ovulation and 1 to 2 days after ovulation. So there's really this 1 week out of the month where you're really fertile. What does safe sex look like? Safe sex should be consensual, where both people want to engage in sex together, with protection from sexually transmitted diseases, and with protection from unintended pregnancy. I really like this little FRIES acronym from Planned Parenthood about consent. So consent is freely given, it's not forced, it's reversible, you can always change your mind at any point. It's informed, you feel educated on what's going on, it's enthusiastic, you feel good and you want to, and it's specific. You've discussed a plan with your partner about what you want. Okay, let's talk about masturbation. So masturbation is also called self-pleasure. It's touching your own body for sexual pleasure. It's completely normal and healthy, and it's how you learn about your body and what feels good to you. Okay, let's talk about sexual orientation. So sexuality is who you are attracted to, men, women, or both. Romantic and or sexual partnerships between 2 women are normal, and romantic and or sexual partnerships between 2 men are also normal. Safe sex for same-sex couples may look a little bit different than for different sex couples. For instance, you wouldn't use a condom for 2 females because there's not a penis involved. Okay, last but not least, we will talk about birth control and STI prevention. So condoms are used over a penis to prevent semen from entering the vagina and also acts as a barrier for STIs. It's the only form of birth control that prevents STIs. So you can use a condom in conjunction with another form of birth control if you want to prevent STIs, which you should want to prevent STIs. The pill, the patch, the IUD, the shot, and the implant all work to alter a female's hormones and stop ovulation, with the exception of the copper IUD, which works to create inflammation inside the uterus to stop an egg from implantation. The diaphragm really isn't used very much anymore, but it works as a barrier between the cervix and semen or sperm. And then the fertility awareness method takes education and skill, and it may not be right for beginners, but it takes things like basal body temperature and body signs to know when you're fertile. So that's it for my presentation today. Thank you for listening. If you have any comments or questions, please let me know.